Hi, I'm Dr. Harley Moseley and welcome to the Stone Age.
Please tell us your name and what you do.
Hi, my name is Harley Moseley. I'm a physician. I specialize in physical medicine and rehabilitation, and otherwise I'm known as a physiatrist. This is simply a physician who takes care of patients in such a way that it can improve their quality of life as well as their functional capabilities.
Okay. That sounds like a mouthful. Like what got you into medicine?
My parents are both doctors. And I saw the way that they handled people, and I admired both of them. They both have their strengths, and I took that with me along with a natural curiosity for biology, as well as I quite like talking and socializing with people. I thought it would be a natural fit.
Okay. Tell me, how did you get into, as they say it now, and I would be politically correct, cannabinoid medicine?
You don't have to be. But initially, it started when I was specializing up in New Jersey, where there was a lecturer, Professor Thomas Strax, who went through on the treatment of spasticity, which is stiffness in the limbs which is caused by either strokes or trauma. And he had mentioned that marijuana was very good at treating spasticity. So it so happens that 40 years later, I was asked to give a lecture at the Barbados Council of the Disabled. And I happened to mention, because there are a lot of patients there who suffer from spasticity. And I was asked a lot of questions, and I happened to mention that marijuana treats spasticity. So if you fast forward again, 4 or 5 months later, one of my patients, multiple sclerosis, patient, she had run out of medication, and she came in my clinic, and I noticed that her limbs were moving a lot more easily than I was used to. I said, "What happened here?" And she looked at me and giggled and said, "I had a puff or two of some marijuana. Remember, doc, you taught me how to do it." I was like, "Oh." But having said that, I then realized that I might be onto something. And I encouraged a couple more of the patients who were multiple sclerosis patients that remember that lecture, and educated them, and they tried it, and they were moving a lot freer. But mind you, the number was very small.
Around what time was this? What year?
This would probably, I did a lecture in around 2007. Mm-hmm. So we're looking at anywhere between 2008 to 2010.
Okay.
And then, of course, again, that number was very small. And I had trouble convincing my colleagues that it worked. And then along came this poor lady she had terminal cancer. And she had been to 8 specialists to control her pain, 4 here and 4 in Canada. And she'd come back home and I was number 9. And she wanted me to do something about her pain. So initially I tried conventional medications with her, and I said, I wasn't sure what to do when she came back and said they weren't working. And the cannabis suddenly came into my head, and I said, "Well, Mom, maybe you could try a little ganja tea." It's kind of like a Hail Mary pass. And lo and behold, the next visit, she came back and said that she was feeling much better. So I encouraged her to do it. But of course, she didn't want her husband to know. Now, having said that, when she initially came to see me, she was bedridden and was complaining of not being able to sleep. Just before she died, on her last visit to me, she was now back to gardening, and she was sleeping the night away, and she had actually got back her quality of life and started to walk around her yard. So after she died, her daughter sent me a nice letter, basically thanking me for everything that I've done, and I prefer to keep her anonymous.
Understood.
But subsequently, about 2 or 3 months after that, along came Mr. Trotman and his wife Kathy Trotman, and they again gave me the similar scenario that they had been to everywhere from here to Jamaica and back, and they had been able to get a script written in Jamaica for medicinal cannabis, but they could find no one in the island that was willing to write medicinal cannabis for them. Having had the previous experiences, even though as small as they were, and seeing how much discomfort Miss Kathy Ann Trotman was in, and the fact that she was reluctant to try any conventional medication. I wrote conventional medication for her numerous times on scripts, and she would not fill them.
Why?
I think that she did not trust Western medicine on a whole, and she was willing to try medicinal cannabis. So with that, and given the fact that Mr. Trotman said that he was able to get through contacts permission for script to be fulfilled, I said, "Oh, fine, let me write the script." Now, before they had come, I had been trying, along with some other lawyers that asked me to forward the cause, and I had said, "Well, fine, let me," and I'll leave them anonymous for now, but I had been written 2 or 3 scripts for other patients to try and get medicinal cannabis, and it was disallowed. Even though it was a doctor writing the script, and there are laws saying that it is allowed once a doctor writes. There's something that's a bit gray. Mr. Trotman will clarify that a little more. But I was treading the gray line, and 3 patients had tried and they were not able to get it through that means, through the pharmacy and stuff. Now, having said that,
Were these people terminally ill patients as well?
there were different
Okay.
areas of patients, because one of the things that it works very well for and is scientifically been proven is chronic pain. And about 80% of my practice is seeing patients who are in chronic pain. This is simply pain that has gone on for longer than 3 months, and we can't find a cause necessarily, or whatever has caused it has healed, but it's still in pain. And it was basically 3 chronic pain patients, but they were actually pretty benign compared to most of my chronic pain patients. A lot of them have tried numerous medications and have suffered numerous side effects. They're very mistrustful of allopathic or Western medicine to some degree. And the main complaint, 2/3 of them, is that they can't sleep. So along comes this whole idea that as we looked around the world, and also incidentally, which was quite ironic, my wife had recently gone to Uruguay, and she called me up one night and says, "Tony, they're going to do it." I said, "Do what?" And she says they're going to legalize marijuana in Uruguay. I said, "What?" So what are the odds of her being there? So she actually brought that. We have a copy of the newspaper somewhere, of the actual first newspaper. But having said that, that got me curious as well. I'm seeing effects on my patients. I'm seeing, and those patients who were willing to listen or read the latest literature and decided that they would give me feedback on what they had been educated on, they were able to tell me that their patients who hadn't slept in 8 years were now sleeping peacefully through the night. Or patients who had had pain that with 4 or 5 different medications they was unable to ameliorate the symptoms, they were now suddenly pain-free. Patients are now able to get back to work. They were able now to be useful spouses and wives and husbands, lift up their grandchildren and play with them, and then basically their life had returned to them. So that convinced me that there's something that we are missing. And it's very, again, anybody hearing me now would want to know if this is the same Dr. Moseley who was completely against marijuana in any form. Up to 2-3 years ago, I was completely an advocate against it, namely because of the whole connection with chronic use and schizophrenia and psychotic illnesses. But having seen the difference that it has made in my patients' quality of life, and seeing the difference that is made in patients whose pain has almost decreased by half, I think that we run the risk of throwing out the baby with the bathwater if we don't take these into consideration.
So tell me where you're at now in terms of marijuana and schizophrenia.
Well, there are technically four confirmed or reasonably proven facts that we know about marijuana use in the population that have guided our decisions with the use of medicinal cannabis. One, it's very good for chronic pain patients. Two, it's very good in post-chemotherapy patients for nausea and vomiting. And three, with regards to stiffness of limbs or spasticity in multiple sclerosis patients, has been proven to be beneficial. However, the fourth one detracts, which is that chronic use of marijuana or cannabis in any form has been associated with an early onset of schizophrenia or psychotic disorders. So that is still waiting to be disproven or confirmed because in the past, because of the illegitimacy of the whole medication / cannabis, as well as also the size of the studies have been incredibly small. It's been very difficult to find correlating evidence that is easily reproducible. So as a result of that, what has happened is that we've had to depend a lot on very, very scanty and poor data. So I'm hoping in the next 5 years that we will get decent quality research that will show, either prove or disprove the whole link with schizophrenia.
Correlation does not always result into causation.
Right.
So although there's some that have become schizophrenic as a result of using cannabis, is there a possibility that it could be that they were naturally predisposed to the condition, and as a result, using cannabis was sort of, the straw that broke the camel's back?
It's possible with almost anything with regards to the size of the studies. And if we're going to be very scientific about it, we have to get better studies. I mean, there's even a study out there that's possibly showing that schizophrenic patients are more predisposed to using marijuana as a result of that. And it's not necessarily a causative effect, but they seek it out to control their symptoms. So we need to do a little more research with regards to side effects and poor outcomes with regards to the plant, as well as, to be fair, also the positive outputs. But the studies and study size samples need to be improved, and the first thing for that step to take place is legalization.
Has schizophrenia or psychosis been a concern for you for any of the patients that you've treated?
Yes. Almost all the patients that have expressed some curiosity about using cannabis in a medicinal form, I have tried to educate them and find out from them whether they have a family history of psychotic disorders or schizophrenia, or they themselves have ever had schizophrenic or psychotic disorders. And that would be sort of a screening tool. And so far, in terms of our scientific and medical literature, that's the best way we can identify an increased risk of schizophrenia outside of extensive testing, psychological testing.
Have you ever, well, not ever, but have you seen any signs or symptoms from your patients as yet?
No.
Okay.
No.
So, in terms of your own personal treatment of your patients, where's your stance on the correlation between cannabis and schizophrenia?
Well, my stance is that once there's a family history, or if the patient shows or has exhibited signs or symptoms of schizophrenia, or has had schizophrenia or psychotic disorders in the past, I would not expose them to cannabis in any form. Okay.
Let's look at the social and I guess a bit of the psychological effects of you delving into cannabinoid medicine. What has that been like for you?
For want of a better term, it's been interesting.
Yeah, how so?
Because one thing you start to recognize, in spite of the social aspect and the stigma that has come about through miseducation and myths in the public, that when it comes down to patients and seeking relief and quality of life, they come from all walks of life in every single strata of society and every single religious denomination. It's almost ironic that sometimes over the last 6 or 7 months, when we've seen the church itself, whether the Pentecostal assemblies, putting out a paid ad in the newspaper, that almost 1/3 of my patients who are asking about medicinal cannabis are Pentecostal Christians. It's quite, so as I said, it comes from all walks of life, and it does not, chronic pain, illness does not discriminate in any form or fashion.
What has been your family's response when you told them you were looking at cannabis as a form of treatment for your patients?
Well, I can tell you that there's only one detractor, which is the most important detractor, arguably, and that's my mother. She's like, "Oh no, you're going to be the cannabis doctor, don't do that." And I had to tell her, "No, Mom, I've seen so many positive changes in my patients, that is something that I have to stand up for." But my father, he's an old professor of anesthesia. He said, "Wow, you're lucky I wasn't there. I'd be using all my patients to put them to sleep."
Really?
Yes, my wife, even though she's a pediatrician, she's fully supportive of it. My in-laws, I don't think, are quite supportive of it. But in terms of my extensive family on my side, my cousin, Harley Moseley, is a lawyer who was pushing for the legalization on a whole for recreational, which I'm not for. But having said that, and my uncle, who's another attorney, has been saying, "Great, wonderful, when can I get some?" So it's been overall very positive. I think my mother's slowly coming around that there is something to this.
Neighbors, children, their teachers, other parents?
Oh, I'm glad you asked that. I almost forgot my children. They're the second biggest critics after my mother.
Really?
No, believe it or not, my daughter looked at me and said, "Oh no, not all my friends are gonna think that I smoke weed." So my two boys are a little indifferent, but definitely my daughter was a little horrified. She said, "No, you can't do that, no."
Have they gotten any backlash? Any sort of feedback, negative or positive?
I think personally, there are a couple of people asked them, "Wait, your dad is the guy that's the doctor that's interested in weed," and nothing more than that. Nothing more than that.
What about your patients? Have they felt any stigma from, if they've told anyone about using cannabis for medicinal use?
No, I think it's the exact opposite. The patients they themselves are the best example of how well it works. And when people see them and say, "Wait, weren't you the one that was grumpy and couldn't sleep?" and look at you, and I'm starting to get patients who are inquiring because they saw another patient on it who was doing extremely well. In fact, and then even to show you how positive it has been, one of my patients, he used to smoke before. He says, "Man, doc, I will go up there in public and I'll tell everybody everything, man. Just tell them come to me. I'll tell them everything about mine, but it works." And this was a gentleman who was an amputee who was using it for phantom limb pain or sensation of the remaining limb that's not there. And he said that that's the only medication that works for him.
Do you have any patients? Well, actually, let's talk about some of your patients you've mentioned already. That you said could not get their prescriptions filled. They couldn't get access to the medical treatment. How does that impact their lives?
Oh, good question. Mere fact that they can't get anything to control their painful symptoms usually means that they are struggling. No sleep. Just think about it, they're grumpy. So even thoughts of intimacy with their spouse and then that goes through the window. They go to work, but yet they can't maintain a job sometimes because they're always calling out sick. Their salary comes down. Some of them have become unemployed. So I mean, the mere fact that you're trying to improve their quality of life and get them back to work means that it tends to do something to a person's self-esteem, that they become a provider. And unfortunately, in our society, we're viewed as whether you're a decent man or woman and how much you can provide for your household.
My question is, if, well, you said is access to the medical treatment, is money ever a factor? Or can all your patients who get a prescription from you right now that are able to receive means, theoretically be able to receive whether it's CBD oil or whatever it is money ever an issue in terms of having access to medical cannabis?
That is an excellent question. I see you're trying to put me in trouble.
I'm not trying to put you in trouble.
But I will answer it as honestly as I can.
Uh-huh.
And essentially what has happened is that the patients have told me that they have been able to get oil on the black market, cannabis oil, which works by putting 1 or 2 drops under the tongue. Sometimes as many as 12 drops under the tongue, but it works. It depends on what the patient is, size, and that sort of thing. But they've told me that they've been able to get it for, as when initially I asked them, they were getting it like $50 would give them a 3-month supply, and $150 would give them a year supply. Now, if you sit down and work that out, that is cheaper than paracetamol, and it works. So the issue there is there's a possibility of local medication being made in the backyard in the Caribbean that's a lot cheaper than some of these imported medications and fewer side effects. However, it hasn't been studied. Now, on the converse now, when I heard in the conference that we recently had, my colleague using the Canadian produced legitimate oil in Cayman Island and charging anywhere between 200 to 400 Cayman dollars. Which one would you rather use? Well, which one do you think your pocket is going to allow you to use if you were a patient?
Obviously, the backyard illicit.
And therein lies the issue. I think I applaud the government in trying to get the legislation and this approved and the stigma of the medication reduced. However, I foresee a danger in the importation of medicinal cannabis products from out of the Caribbean to treat Caribbean people who have been using local backyard products for centuries. And therein lies an issue which I think is going to arise sooner rather than later, especially given the fact that marijuana on a whole, or cannabis, has a very high therapeutic index. Therapeutic index is a measure by which we measure medication and how safe it is. The higher the number, the safer the medication is. So the problem is, Panadol has a therapeutic index of 5 to 1. Advil has a therapeutic index of 8 to 1. Morphine has a therapeutic index of 70 to 1. Marijuana, cannabis, has a therapeutic index of 40,000 to 1. So, it's also borne out in the medical literature that there has been no recorded deaths from the overdosing of marijuana either. And it's thought that it's because most of the marijuana that is ingested into the body, whether it's through smoke or other means, or absorbed into the body too, is lipophilic or loves fat, so it dissolves in the fat. So the more it comes in, the more it goes into the fat. Now, that is not to say, the argument is already starting, that if the public knows this sort of information, that they're going to say, oh, well, marijuana is safe, let's all smoke, and recreational there's no problems. However, I will say that the medical research needs to be a high degree of gravitas or weight needs to be put on medical research that has been done properly before we start doing a carte blanche on medicinal cannabis.
We're going to touch the research in a little bit, but let's backtrack for a bit. Now, you've spoken about people using backyard oils,
Yes.
and it's working. Let's just say you prescribe one of your patients they're not able to spend $150. They're not able to spend $50.
Mhm.
But perhaps they could grow a tree in their yard and make their own. Does that discount it as being less medicinal as opposed to if it was grown in a sterilized sort of area, which some have been defining as the difference between medical marijuana or cannabis and regular cannabis?
Well, I have to admit that it may not be in a lab, but you have to look and see what is it that you're using the substance to do. Now, if you're growing a tree in the backyard, bush tea from your grandmother, is able to do the same thing that a medication that has come manufactured in a lab that we have to import, that has duties and taxes added onto it, and it can achieve the same effect, then we have to be cautious in saying that one is a medicine and one isn't, because as far as we can see, they both cause the same effect. And some people will swear that the backyard one has less side effects. Now, having said that, if we were to look at an educated correlation of all that we know in our training, there are some medications that were discovered in the backyard. Look, for example, aspirin. Aspirin, for years, they were boiling willow bark in England and Europe to cure fever. And after a while, they said, well, Bayer decided that they would isolate it, and as a result of that, we got aspirin. Which, incidentally, if we were to carry out even quarter of the stringent rules that we have for testing medicinal cannabis nowadays, aspirin would not pass. With regards to side effects and that sort of thing.
Mm-hmm.
But however, it's a useful drug. We use it now to prevent heart attacks, headaches. We use it to prevent even strokes sometimes. Sorry, not strokes. Heart attack and headaches for sure. And also to treat pain in any other form. But having said that, on the converse now, there are a lot of medications have also been discovered through anecdotal use, backyard things. And what it's showing is that a lot of the backyard medications need further research. And one of my favorite examples is right here in the West Indies, where we've known for some time. I think it was actually discovered through the University of West Indies in Mona, where the Jamaican ackee has an amino acid called hypoglycin, which actually was the initial testing started when a lot of hungry children in the 1930s and 40s were eating green Jamaican ackees and dying of Jamaican vomiting sickness. And that led to the investigation of the Jamaican ackee and the isolation of the amino acid hypoglycin. Now, one would think if one could look at that, and that we have a substance that occurs in the plant that drops people's blood sugars so precipitously, where in Barbados alone we have almost a third of the population with diabetes mellitus. Someone needs to research that. Why are we always waiting for the Western world to show us what we have to do and taking instructions from them? And then if they're not listening to the Western world, then the other set of people now listen to the Eastern world and the Eastern medicine and all the Tao and the Chi and everything. When we right now in the West Indies, we have enough brains and enough experience to develop our own things.
So after all that, what would you say is the difference between regular weed and medicinal weed?
Okay. The medical weed.
Or cannabis, if you want to be politically correct.
Or cannabis, to be politically correct. A lot of this started when the whole endocannabinoid system was discovered in the 1980s and 90s. And a lot of fast forwarding, a lot has been touted about the CBD or cannabidiol, CBD, and versus the delta 9 tetrahydrocannabinol, which is the THC. And what has been occurring, because the endocannabinoid system is so ubiquitous in the human body, as found in almost every system. We've been finding that there's an effect being caused in every system by the use of cannabis. So, fast forward again, a group of scientists, again out of Israel and etc., other places, Italy and other areas, have shown that there are aspects of cannabis that were useful and aspects that weren't. And the CBD was found to be the most useful molecule so far at the time, but we're now finding out that there's a little more to it than that. So what has happened is that initially medicinal cannabis was labeled as being cannabis that had a CBD component. So in other words, there was THC, but there was some CBD. And recreational or adult use cannabis was being used to get a euphoric high. On that, the molecule responsible for that is the THC. So the initial simple definition was that once it had in some CBD, you could argue it was medicinal, and once it had predominant THC, it could be argued that it was not, it was for adult use. But we're now finding out that, and research is pointing in the direction now, that that is a little too simple, and that there are over 100 cannabinoids that have been discovered, and you now have over 500 active metabolites in the plant. And so we have over more than 20 years, 30 years, 40 years, people will still be researching the plant. And what we have found, and it's been pointing, is that we're finding that the CBD works best when there's a little THC involved, even a small amount. And we're also finding that there are other substances, terpenes and flavonoids, which also act in conjunction with the cannabinoids. And that there is, the research I predict is going to show that the use of the whole plant is going to be a lot more useful than breaking it into simple CBD. Already there are papers out there that are showing that pure CBD oil is as useful as vitamins. So you must have something along with the CBD. And this can be easily researched by looking at the entourage effect.
Yeah.
And but early days yet. We still have, the studies are still small, and as more and more countries join into the legalization, you will start to see more and more and better research papers coming out.
Okay, speaking of research papers, where do you see, I have a lot of questions about research. This is not quite your area of specialty, seeing that you deal with pain and things like that, but I know that there was a study done that was published in '91 based on, I think they were looking at Jamaican mothers, pregnant mothers, and they were using cannabis tea to help them with like morning sickness and other issues in their pregnancy. They also they studied the children that they had throughout the pregnancy, and they studied them, I think it was like 10 years later, to look at their developmental process. What is your take on, right now actually, I know that there are some doctors, for example in LA, that are prescribing particularly CBD oil. Yeah, CBD oil. I mixed it up with the Caribbean Development Bank, but CBD oil. To help them with morning sickness. And they're saying that it doesn't really pose a risk, despite contradicting studies that have been done back in the 90s and a little bit before that. What is your take on the use of cannabis during pregnancy, the effects on that on the children later on?
Well, a lot of my opinion will be based on the older studies.
Okay.
And the older studies, unfortunately, have been based on the smoking and the chronic use of smoking marijuana.
And those participants also engaged in other forms of drugs, being alcohol and heroin and cocaine and cigarettes as well.
Yes. And having said that, so they're not pure, but they do strongly point towards the fact that the mind is developing in pediatric stage, neonatal stage, and that is easily influenced. And I still stick within the boundaries of the developing mind, which is up to the age of 18 in the English speaking Caribbean and English medicine, and 21 for American and North American. That the exposure to substances that will affect cognition or the way the mind works should be kept to a minimum. That includes medicinal cannabis. Also, I guess it would be rather amiss of me being married to a neonatologist, not to mention the fact that smoking has been associated with low birth rate babies of all forms and fashions. However, having said that, I understand the conundrum that marijuana / using the medicinal cannabis form has been shown to be the only anti-emetic, which is stop the vomiting, that also promotes appetite. And one of the problems that some mothers have is hyperemesis gravidarum, where they throw up too much and they're not getting enough nutrition. So early days, I await the research, but until the research is done, I take the conservative view that the cognition of a child should be left to develop naturally.
What do you think we are at in terms of studies on a global scale? Because then there's Dr. Henry Lowe that's doing research, there's professors in Barbados, all over the Caribbean in terms of at UE, and other people doing their own individual research as West Indians in other territories in the world. What do you think we stock up in terms of global research?
Well, outside of Israel, which Dr. Michelam had been doing research since the 60s, the rest of the world is now getting into the whole medical research into cannabis. I mean, there are going to be detractors out there. They're going to say Italy, and there are going to be some that say, well, look at America even, that there's been research carried on. But to be frank with you, most of the serious research in cannabis has started over the last 10 to 15 years. Now, when you look at the whole history of medicine, 10 to 15 years is a sneeze. So for us to start from scratch, which we're not, because Professor Manley West and another Jamaican ophthalmologist, and he was a pharmacologist, were studying and developed Cannasol for the use of glaucoma way in the 70s. It just so happens that we weren't able to carry forward this studies. But having said that, the Caribbean, I think, is going to catch up very fast. Part of the reason is that the plant itself, whereas in North America, from my North American contacts, I was told that they like to grow it in the summer, and winter indoors is too expensive. So they usually get one, but if they push it, maybe 2 crops a year. We in Barbados, if I listen to my patient, the amputee, as he told me, get 3, sometimes up to 6 crops a year. So the mere speed of producing the crop alone means that the plant research is going to be quite valuable, because we can get more variables because you're increasing your population size by numbers. Added to that, and the history of introduction of cannabis into the region, where it has been in the region now for since the the first Indian immigration into the Caribbean, where after the plantations closed.
It was like 1800s?
In the 1800s for sure. And it has been around and introduced and has now become endemic in most populations in the Caribbean. And I think that we have a lot of studying can be done on a lot of subjects, human subjects, because it's also ingrained. And there's a lot of anecdotal evidence coming out from the so-called legacy farmers and Rastafari. So it's interesting to see how the rest of the world is going to take us, the Caribbean, if we seize the opportunity, being leaders in the study of medical cannabis and its uses in human beings.
So my last question to you is, what are some tips you would give anyone that wants to speak to their physician about using weed or medical cannabis as part of their treatment?
When the legislation comes on.
Yeah.
Just to make sure that
You don't, yeah.
Well, the first thing first, don't refer to it as weed. Now, I think a lot of the groundwork has been done, and I think he has not got enough credit for it, but I will mention it, Sanjay Gupta. The mere fact that 3/4 of the region has cable TV and watch CNN, I think he opened a lot of doors with regards to that. But you must bear in mind one of the common problems that I'm finding out, particularly since as I get more and more into the reading of this, one of my favorite subjects now, is that doctors on a whole in every country are reluctant to start their patients on medicinal cannabis. It's usually, and has been advocated as being the medication of last resort. So, my advice to any patient that wants to bring up the topic or conversation with their physician is, one, read up as much as possible as you can. This is one of the few medications in the world that patients actually know more than their doctor. I say that before my medical colleagues come after me with being like hounds, in that I have always challenged all of my patients every time they come in to know more about their personal condition than I do. And I always have a little game with them. And I say, listen, I have 30 patients a day, and I'm yet to find a patient who knows more about their condition than I do. When you have one condition, all you have to do is go and read up on it. And that is twofold. One, it brings a little levity into the whole situation. Two, it encourages patients to take ownership of their illness and to take ownership of their care. So that yes, I'm a doctor, but I'm also a human being, and I'm not infallible. So if patients can read and say, well, doc, I was reading, but they said that this medication not so good anymore, I welcome that. I don't mind my patients charging me. As I tell all my patients, they're entitled to a ninth opinion as far as I'm concerned. But the point of the matter is, it's more of a discussion about your condition, and not, we've gone from the old, I am the doctor, you will do exactly as I say kind of thing. So read up as much as possible, quote Sanjay Gupta if you need to. Go in there with an open mind. Bear in mind that a lot of your physicians, has been found that a lot of the medical schools, or less than 1% of their curricula has been dedicated to teaching about cannabis or marijuana and its effect on the human system. It's going to change over the next 5 years, but your physician, obviously, odds are he's been out for longer than the 5 years. And to engage, don't be too defensive or insulted if he says no, but try and engage him in more conversations and encourage him to read and learn about it together. I think that is probably the best thing that I could offer, because he's still a physician, and there's more to being a physician than just simply prescribing medication. There's a lot of experience, and there are a lot of other social and economic factors that can go into the treatment of a patient.
Got you.